Hello, and welcome to the how-to webinar on marketing HIV services online. My name is Benjamin Eveslage. I'm a technical advisor for online HIV services at FHI 360 and manage what we call the Going Online portfolio. I support our global and bilateral HIV programs, mainly funded by USAID and PEPFAR, to utilize online and virtual platforms to support the marketing for and service delivery of HIV services. So this is part of a 5-part webinar series on how to take HIV services online. And it's supported by PEPFAR and USAID. Today we're on our 5th and final webinar, and I'll also share the recordings for the previous 4 webinars in the chat. If you are interested in this content, please open the links in your computer or copy them, because by the time this webinar ends, you won't be able to access the chat. All right, next slide, Purvi. So let's go over some logistics. All attendees will be muted as a default. Other panelists should stay muted unless they're speaking. And everyone will use the Q&A function to ask questions for the panelists. Avoid using the chat function for questions, because we'll be really tracking all your questions and ensuring we get responses in that Q&A function. You can send other messages and comments in that chat function though. During this presentation, although it says here we actually will not be using the polls, so it'll be a pretty easy process. And if you have any questions about logistics, go ahead and send them in. Next slide. So today we have 90 minutes scheduled. I'll open the topic by telling our story at FHI 360 for how we took HIV services online, starting with an introduction to a whole range of online marketing approaches. Then we'll hold 2 discussions. Each will be 20 minutes of uninterrupted, informal discussion, followed by 10 minutes of Q&A with the audience. The first discussion will focus on online advertising, particularly using ad managers and platforms like Facebook, Google, and dating applications. And the second discussion will focus on influencer marketing, where an HIV program can engage a social media influencer with a large following to help generate demand and uptake of HIV services. And then at the end, I'll close with reference to some useful resources that HIV programs can use to help them implement these approaches. Next slide. Next slide, Purvi. So no one knows a better story to tell than their own. So today I'll start with ours, about how the FHI 360 supported global HIV projects adopted online marketing approaches into their HIV projects. While scaling up HIV services for key populations just 3 years ago in the Linkage Project, we began noticing trends and demands from the populations that we were meant to serve that were outstripping what our standard HIV program model could deliver. The story is threefold. First, our existing HIV program beneficiaries started to connect more online. This included meeting partners for dating or sex online, as well as using online and mobile platforms to access all kinds of services and information. Today, 67% of people worldwide have a mobile phone. 59% are online, and 49% are active social media users. Most of our HIV programs were completely missing these online audiences and simultaneously losing important face time with the people who were reached physically, but were focusing their attention on their phones. Next slide. We use this graphic to demonstrate the narrow audiences who we reached in physical places, or what we call hotspots. These same typologies of key populations we reached for over 20 years in HIV programs. So we call this Outreach 1.0, or the first generation of HIV outreach. Purvi, if you can just click, there's an animation on the slide. However, online marketing approaches could help us finally reach some of those previously unreached audiences. We call these second and third generation outreach approaches that leverage community members, social media influencers, and online ads to reach broader audiences while remaining targeted to the populations in need of HIV services. We'll go to the next slide. Second, we realized a sizable portion of our target audiences were hard to reach because we offered services in ways that did not meet their needs and preferences. So we started tailoring services across the HIV services cascade by population types, by their health service needs, and by new modalities of service delivery, as shown in this figure here. In the dark blue, you see face-to-face and virtual service delivery modalities. And we asked people what they wanted. We implemented online surveys in 18 countries to see which key populations we could reach online and how they wanted to receive services. After analyzing about 10,000 respondents, we found it was most common for people to prefer accessing HIV information and find and book HIV services from their phone. Next slide. So we built upon our strong foundation of physical outreach and paper or peer referrals to community-based HIV services. Herbie, if you can click for the animation. And we included online and more private ways to be reached and referred to HIV services, including online booking. We also expanded the range of HIV services and providers clients could access, such as convenient and affordable private sector HIV providers and lab services. What I want to focus our attention on here are the three outreach modalities at the top, called network, influencer, and profile outreach, and how we framed each one by its unique value for reaching broader audiences, but also supporting conversion to uptake of services. And also integrally important for this online marketing funnel is how you connect those people you reach online to those actual physical brick and mortar HIV services and how you track that conversion. We'll go to the next slide. Since 2017, we changed how HIV programs could understand their audiences, reach, refer, engage, and track their clients across this cascade of HIV services. You see the cascade here in the center of this framework, those bars that are labeled identify audiences, reach audiences, audiences know their HIV status through HIV testing, enroll those who are HIV positive in care, initiate antiretroviral treatment, and sustain on ART, and finally viral load suppression. This is the framework to reach epidemic control globally. And to support that framework, we did build this overarching, what we called going online vision and framework, which are those green, orange, red, and bluish purple boxes that surround this cascade and support HIV service delivery using virtual and online platforms. We'll go to the next slide. So the third part of our story, entered stage left, is COVID-19. As COVID-19 related lockdowns were instituted in many countries, our standard in-person HIV demand creation activities, such as hosting events, small group meetings, and outreach sessions and hotspots, became really obsolete. COVID-19 also led many people to spend more time on their phones and leverage the internet and mobile apps to find and access health services. A group called We Are Social found that 43% of internet users reported spending more time on social media due to COVID-19 across a sample of 18 countries in all major global regions. They also found a 65% increase in medical app downloads during the peak local month of their COVID-19 crisis compared to January of this year. However, the pandemic occurred at a time when our going online approaches were already quite scaled and matured in many of our programs, particularly Asia. At the start, our HIV programs focused significantly on using virtual and online methods to ensure continued access to life-saving antiretroviral treatment for people living with HIV, things such as virtual case management and home delivery of ART. However, it's now been 6 months into the pandemic, and our programs are now regaining their focus on how to reach and engage with this new or in significantly more online and virtual audience for maintaining the demand for HIV services and supporting that linkage into services from those online platforms. Go to the next slide. So how did we do that? How did we reach and connect with our target audiences online? we use three such approaches. Next slide. The first is online HIV outreach by online outreach workers called social network outreach. You can see the online outreach workers in Thailand on the first phone screen here. We won't be focusing very much on this approach during this webinar. Purvi, if you can click once for the animation and hover over that video and press the play button. The second is social influencer outreach. This is where people on social media who have a large following among our target audiences engage their followers through posts to support behavior change. This video is an example post by a transgender makeup artist in Jakarta called Stasia, who we engaged to demystify the clinic experience to her followers and encourage them to book services online. Purvi will click once more for the third animation. Our third approach is called social profile outreach, which involves using online ad platforms such as Facebook and dating apps to design and target ads to audiences at risk for HIV and allow people to immediately book and access HIV services. This is a picture of an ad on gay dating app Grindr, something we've been able to do for free, given our health focus and our nonprofit organization status. Or if you can click once more, and it'll show an ad on Google, which we're able to also to do for free in selected countries through Google for Nonprofits. And Purvi, if you can click one more time, this will show an ad on Instagram for HIV self-testing in Eswatini that links to a Facebook chat with a counselor to help those individuals access a self-test kit in the country. We'll go to the next slide. So we have several examples from the countries, some of which are on the phone today, and we'll be presenting and giving, well, not presenting, but be sharing their experience based on using a range of these approaches. This is just showing the impact of using virtual approaches during the lockdown period in Thailand. You can see the dates along the bottom and the key events that occurred during the COVID-19 crisis. And those lines in blue and red are showing the increase in reservations and arrivals for services through their online booking platform called Test Me Now, which helped bridge the gap in service delivery during this time. We'll click once more, Purvi. And this is showing that during this time, March through July, it was the first time ever that the project identified more HIV positive clients through their online approach than physical outreach. We can see here in the slide, 35% of all clients identified as HIV positive were a result of them being reached online and booking through their Test Me Now platform. Next slide. This is the way that the Thailand team visualizes their results by their marketing approaches. Their Test Me Now website allows each promotional approach to have a link that is unique, and it can be tracked based on the platform used to do the promotion. So you can see here their promotions on Blued, a dating app in the Asia region, versus Instagram, versus Facebook and Google, the number of people coming in, testing positive, and the case finding rate for each of those. We'll go to the next slide. These are some results from Kenya, also using an online booking platform. They have a more niche and narrow approach, but they started using ads, influencers, and outreach workers. And after the first 5 months, they continued only with online outreach workers. But to date, and this is over 18 months of implementation, the highest number of people reached still came from those first 5 months of the influencers and ads. However, the performance in terms of getting people into the actual services and getting HIV tests or other services, outreach workers greatly outperform the influencers and the ads. We'll go to the next slide. In Indonesia, social media influencers boosted the overall HIV case finding in Jakarta through a surge in posts and videos that led people to book services or walk into clinics to access HIV testing. You can see here during the months of July and September 2018, the 23% boost in HIV case finding that corresponded with these influencer promotions. What you can't see here is the 58% increase in case finding at the clinics that influencers linked their followers to book at through the project's online booking site, updatestatus.id. Next slide. The Linkages Project in Cambodia also employs ad and influencer-based approaches to reach young men who have sex with men on social media and dating apps. They developed a web series and broadcasted 11 episodes on different platforms such as Facebook, YouTube, and Instagram. In the month of June, they were able to reach millions, including over 607,000 video viewers. In addition to the web series, they engaged social media influencers, such as Rainey, who's shown here, and featured in the content that promotes a website used to book HIV services called toetest.org. And what Rainey does is he reshares these posts to his own 240,000 followers on Instagram. Next slide. So as we move into our discussions, I wanted to highlight several important factors for planning and implementing online marketing approaches for HIV services. So our panelists can take a note of these different considerations and be sure to ask questions that are relevant for these. And anyone on the call can also look at these or ask their own questions to the panelists using the Q&A function. So of course, how would you plan for these different online marketing approaches? And when would you use one over the other? What creative design needs might you need to put out an effective influencer approach or using online advertising? How do you target your audience using these approaches? And then also, what are the costs for using online ads or influencers? And how do you actually make payments as an HIV program to use these approaches? How have you tracked the results of those you reach online for offline uptake of services or any other metric you're using to measure your success of these marketing approaches? And then what were your results compared to the approaches that you used? And did you find any risks or problems with the approaches, and how did you mitigate those? So just keep these in mind, and perfect, we'll go to the next slide. So in a few moments, we will start a fishbowl activity. In this activity, we'll have a small group pretend they are merely having a private conversation with each other, speaking honestly about the good, the bad, the ugly about marketing HIV services online. And participants have the benefit of listening in to their conversation, like looking into a fishbowl, and the fish are unaware. Our first fishbowl will include people who bring diverse experience in online marketing, including some HIV programs with experience using online advertising. The fishbowl format is meant to support your unfiltered learning about the reality of planning and implementing these approaches. So let me go ahead and introduce each of our fish. Next slide. So first we have Jen. Jen is the director and co-founder of Building Healthy Online Communities, which is a consortium of US governmental and non-governmental organizations working closely with dating app owners to integrate prevention and treatment into their apps. They do this by improving profile options, including testing reminders, and improving agencies' online advertising strategies. Next slide. And we also have Dan, also from Building Healthy Online Communities, who's a co-founder, and he'll also be joining us. Next slide. We have Becky, who is a key populations technical advisor at FHI 360 in Eswatini. He joined in 2017 and is supporting the overall key population program implementation. As part of his work, he has supported the development of online HIV service delivery in Eswatini and has used several online advertising platforms to deliver HIV services in the country. Next slide. We're also happy to include Yatin. Yatin works as an associate vice president at Leo Burnett, India, and is leading the Leo Burnett Digital. He joined Leo Burnett in 2014 and overall has experience of 12 years creating impactful business solutions using the power of digital for Leo Burnett's clients. Last year, Yatin and his team partnered with FHI 360 to deliver one of the most successful and creative digital outreach campaigns to reach out to key populations online for the Yes for Me project in India. Next. Next, we have Oates, who has worked with FHI 360 as a senior technical officer for key populations and the linkages and EPIC projects since 2015. Oat has worked side by side with partners and media agencies for planning and managing the first PrEP online platform called Prep Me Now in Thailand that started since February of this year and has more than 5,000 followers, as well as provides technical assistance to partners on the online outreach platform and strategies. All right, we'll go to the next slide. Great. All right, Fish, you have 20 minutes for the fishbowl. And Jen and Dan, you can kickstart the discussion and anyone can take it from there. If there's an awkward silence, you can see the default order on the slide. And when you're done and have nothing else to contribute, you can simply say, thank you, no more questions from me. And I'll let you know if you're going over time. Otherwise, this is your discussion and you can end early as well. After the fishbowl, we'll open up the chat and we'll be able to direct questions from the audience back to the fishes, and that'll take about 10 minutes. So fishes, are you ready? Time to channel your inner acting skills and pretend we're not here. Turn on your mics and your cameras. And Jen or Dan, please take it away. Feel free to ask the group an individual about their approach, how they did it, lessons, future plans, whatever you like. All right, Jen, Dan, Becky, Yatin, Oat, you're on for online advertising. And Dan and Jen, take it away.
Great, thanks so much, Ben. Can you hear me? Just making sure.
Perfect.
Yeah.
Okay, excellent. So, we're here based in the US and we've had some very interesting experiences working in partnership with the apps, as well as our public health partners, and recognizing that everyone seems to have a question about, are we spending our dollars well? So one thing we've tried to do is try to answer that question and try to figure out, what happens when we buy ads or are able to leverage free ads. So questions that I have for the fellow panelists are, have you been able to reuse any creative ads so that you don't have to create your own from scratch? So one thing that we're noticing in the US is that it costs a lot of money to develop new campaigns. We have the benefit of organizations like CDC who are developing ads that can be used across the country. And we've been encouraging our partners to use those ads whenever possible so that they can save money and use that money on placement. So a question for you all, does something like that exist in your areas? Do you have ads that you can use from other organizations or from like a international or national group that might help you save money on the creative and then put that toward placement? That's a question that we've been thinking about a lot. Curious to hear from fellow panelists.
Well, as far as India goes, we never had anything like that. Look, there are organizations in India, which are supported by government, and there are independent organizations who are doing a lot of good work. However, in our case, when we created a campaign online, we started from scratch. So what we got is basically a lot of intelligence from the team at FHI, and we took it. We conducted our own surveys. We reached out to some of the key populations, got a lot of insights, and then we kind of married it together and built our own campaign. So as far as India goes, in our context, no, we did not use anything which was readily available.
And thank you for sharing that. And can I ask if you think about kind of how much it costs to develop that campaign compared to either spending money on placement, or maybe you were able to get free ads? Did you find that it cost a lot of money to actually build out that campaign?
So look, to be realistic, it does cost a lot of money to create something from scratch. However, for us, the challenge was that we were given an upfront budget. That look, this is what we have, and what can you guys do with it? And I think that was the challenge, which we enjoyed the most, because, and then let me be honest, like, there were no big budgets, right? We were given that, look, these are our social channels, these are the key populations we want to reach out to, these are our objectives, how can you do it, right? And I think
Yeah.
what really worked for us is that we got the insight right. We got an understanding of the consumer and married it with cultural context, in the right manner. And apart from that, what we did really really well, and which I'm super proud of, honestly, is basically, we did a lot of testing, right? Our approach was very, it was driven by, develop, implement, test it out, learn, and then, you kind of go on optimizing it. Not just placements, but the creatives as well, right? So if I look
Yeah.
at everything, it just worked for us. And if you want, I can talk about how did we go about creating the campaign, because that was really really interesting, and and it was deeply rooted in the Indian cultural context.
Yeah.
So I think the creative and the placement both worked really well for us, and it delivered the desired results that we wanted.
And I'm curious now that you've done that, because as you said, it's a lot of work and it can cost some money and take some time. Do you think that there are other organizations within India that might be able to use it? So for example, like in our conversations, part of what we've been realizing is, well, if we plan ahead and we have everyone sign the right releases and all of that stuff, then we can enable these campaigns to be used for a longer period of time by, more partners. Especially groups that maybe have a smaller budget and aren't able to do, what you did. Do you think that other organizations within India might be able to do that with your campaign?
Look, as far as what we created for FHI, we gave all the rights for them to use it the way they wanted,
Mm-hmm.
right? So I think we have Purvi from FHI India team. So anybody who wants to use our campaign, and if they believe that it works for them, or it might work for them in their markets, they should
Yeah.
reach out, and
Well,
they should.
that's really smart. I'm glad that you thought ahead and did that.
Yeah.
Yeah,
No, no,
because based on,
yeah.
yeah,
Absolutely. What we
based,
did was we
sorry.
basically developed a whole bunch of creative work, which worked really well on social media, Google Display Networks, YouTube, TikTok. We created a lot of SEO content, blog content, so on and so forth. And we just, gave it all to them, because I think, one, there was that for us, it was a project as an agency, right? But I think we could see the larger impact of what we were doing. So we just went all in and all out for it. And, we just created what we believe was one of the best creative pieces of work that we have done last year. Definitely.
Well, I would love to hear a little bit more about that in terms of what, the process of what you created, but then also, yeah, I think for folks to realize that now that you've put all that work into it, there may be other groups that could use it,
Yeah.
because, then for them to not have to start from scratch, and also to create things that maybe have some flexibility where you create a digital asset, but you can sort of like maybe change the contact information on it, or, if it has that kind of information.
Yeah, so absolutely. Let me talk about the campaign a little bit. I think, we have a lot of people who are already doing a lot of stuff in it, and in this space. So our campaign was really really simple. Like, if I talk about India, right? Anything to do with HIV, right? It is not a conversation that you have in open, right? It's not a dinner table conversation, right? And I'm sure that this is the same struggle. I'm sure that a lot of other members of this team and this community face in their market. So one of the things that we said, that how can we how can we simplify this conversation, right? What are the things that we can pick up from our day-to-day lives, that we can marry the context with, right? And what we kind of, when we were brainstorming, and we said that, look, what, uh, why do people hesitate in talking about this thing, or why do people hesitate in saying that I want to get tested for HIV? It's because of the fear of being judged, right? The moment you say HIV, people are like, oh my god, what is this guy up to? uh, that's what it is, right? So what we said is that, can we pick up things that are happening in our day-to-day lives, okay, which people are doing without the fear of getting judged? And like for example, I'll talk about a very simple debate that that got a lot of traction online, that is it okay to have pineapple on a pizza? And there were divided forces, right? So what we did was, we basically picked up these instances from our day-to-day lives, and we said, we came up with a very simple proposition, that it's okay to get tested for HIV, right? And then we married it with various situations in our lives. So for example, if somebody's bunking their college classes and going to watch a movie, it's absolutely fine, right? If it's okay to do that, it's okay to do this. So we started drawing these parallels, and we could come up with so many situations from our lives which people could relate to, right? And that really brought the conversation alive, that look, it's not as it's not as complicated as as it sounds, when you hear about it. So we just pulled out a lot of moments from our lives, and a lot of things that we do, that we believe that it's okay to do this. So you know what, if you do this, it's okay to do that, right? And we went ahead and deployed it on Facebook, Instagram, YouTube, Google Display Network. We did a whole lot of content around it. And the approach that we took in terms of creating content was very, very simple. We did not use any real imagery, or we did not show any real people. But what we did was, we used a lot of vector-based creative work, right? Our creative work was something that we felt that it should be scalable. We should not get stuck with one phase or anything like that. And something that we could create on daily basis, right? So it was a 3-month period, and we created approximately 100 pieces of content over a period of 3 months, which we were publishing daily. And then we were using paid media, etc., to kind of reach out to our key populations, and they really work for us. In a market like India, and what was the real success is that we did lead generation campaigns, right? Where people, when they saw our communication, they felt compelled to leave their personal details, so that our sexual health managers could go and reach out to them. I think that was a big victory. So that's something, when that started happening, we could feel the power of the work that we had created, because it compelled people to give out their personal details, right? Which is not really the case. And then all those leads and everything that we could collect from the campaign, they were given to the team, and they kind of took the conversation forward, and got people tested. So yeah, I mean, that was really the overall process. The work is out there. I will put up the link on the Facebook page. You all can go and see it. It's a really interesting piece of work. As Leo Burnett, we are super proud of it. And in case anybody wants to connect with us to discuss more than happy to kind of help you guys in whichever way we can.
That
Jen,
sounds, yeah.
This was really interesting. I mean, I echo everything that Yatin just said, because I have been a witness to this wonderful work that they've done for us. I would also like to actually understand from Thailand as to how do they create their content, knowing that they've been doing online outreach for the past 2 years, or a little more than 2 years actually. And what we saw in Ben's presentation earlier, I think a lot of work has gone on to them promoting all of their work on different social media platforms. So what do you think was the best way to identify your target audience, and what was the kind of content that you chose for them?
In Thailand, we are just focusing on many target audience when we are doing the online advertisement. I'd like to example our Prep Me Now Facebook fan page that we are just starting on February. Firstly, we are thinking that we want to make our Facebook fan page to be get more followers. We are setting the target audience very broader, and the consequences is that we got a lot of inbox people that want PrEP from across the country, that we did not have our service provider at here. So we just rethinking with our media agency again, that so we cannot do that again, because that we have the limited funding. So we are thinking again that, okay, we are just focusing the one who really need PrEP. So we are discuss with our partner and we come up with the list of the profile audience that we want to reaching out. We want to reaching out to the well-educated, gay identified men and fitness-driven men. The reason that we are using selected this target audience because that another gay community in Thailand are looking up to this certain popular audience and want to be just like them. If we are create the advertisement to target them, and then we sprint it out, the interesting to broader target audience. Yeah, this is the reason that why we are target audience to just specific audiences in the Facebook.
I'm also curious to hear about the different platforms and how you're either able to leverage free advertising, or when you've had to pay for it, kind of how you're measuring what works. Are you sort of testing out multiple different platforms and then sort of putting more toward the ones that work best? One thing we've seen is that some of the dating apps can be really good for kind of making sure you're increasing awareness among MSM, for example, but often, not always, we see like more engagement and conversions from some of the social media, right? Like Facebook or Instagram or some of those others, you know, perhaps because they're less distracted or they're in a position to sort of click a little bit more around. So curious to hear kind of your experience with that. We've also seen just situations where it even matters kind of how you buy it. So if you're going through some of these like Google Ad Manager, it can actually get you cheaper rates for some of the same placement. So I'm just curious to hear some of your experiences around that. Are you finding certain platforms to work better, be less expensive, be more effective? Anyone on the panel can answer that one.
All right. I would like to take this one. So for us, our experience is in Eswatini is, you know, social media platforms work better. For instance, Facebook here, other than dating apps. So mostly because of the context, you know, most of our key populations are hidden and they don't use dating apps as much as they would use, you know, social media platforms like Facebook. So we reach more with social media platforms, especially Facebook. But also what we have learned is that with a paid advertisement, we have also been able to reach even more, like our coverage is even higher with the paid adverts. So one of the things also that we have also done is that we have used the context or situation to develop a related advert. For instance, during the COVID period, we've developed adverts that talks to, you know, PrEP and ART refills, because most of the people at the time were not able to move to facilities to access their refills for ART PrEP. And then we use that opportunity to do adverts for our DICs. And then we've seen really a lot of engagement and people coming to access services through those adverts. I mean, which were paid adverts. Yes. So, yeah, for now I can share that.
Awesome, thank you. That's really helpful to hear.
I have another point to share on this. I think that for Thailand, I think that if we are thinking about reaching to the large number, we are just thinking the Facebook, because that in Thailand, a lot of our key population are using Facebook. But when we are looking on the result of the people who are register and get testing and found positive is not different. We found that in the dating app, is we reach a small number, but the case finding is higher. But the way we work with the dating app is different from the Facebook, because with Facebook mostly is the advertisement. We are creating the post and buying the advertisement from Facebook and launch it. But the dating app is different. We are using the outreach worker to working inside the app, just like they are creating the profile and make contract with the client in the dating app and try to persuade them to get testing. This is the way to work in the different platforms.
Thank you, Ot, and thank you, team. We've reached the end of the 20 minutes for this first fishbowl, but it's now time to answer some questions from the audience. So if the panelists can open up that Q&A, and if there's any particular question that you really would like to answer, you can go ahead and you can click live answer, and you can unmute your microphone and respond. There's one first question I want to bring to the team from Sam, who's actually in the next fishbowl. She's interested to know about the type of visual or aesthetic that was used and the performance of each of those in the different markets. So such as using photos versus illustrations versus videos versus motion graphics. And do you have any results or experience on the effectiveness of those different kinds of creative assets in the ads that you have used? And this can go for anyone.
In Thailand, we found that the post that indicating about the statistic on the number is quite successful in terms of engagement.
So you're talking about posts like a static post that has just a simple image.
Yes, just like the case finding of the HIV prevalence in Thailand among MSM and G, something like that is very interesting for the target audience.
Mm-hmm. Something that we learned in India almost before we engaged Leo Burnett is we had ads on Grindr, and we did some paid ads on Grindr with a banner that was a large image that covered the screen and advertised the services. And we also used the free option of a broadcast message, which is a text-only message that pops up over part of the screen. And we found that the text-only pop-up, which was free, performed much, much better than the banner ad that covered the entire screen and used a graphic, used an image. So that was interesting, and it was also free. Any others on the call that have experience about the type of creative content used and its effectiveness?
So as far as the Indian market goes, our learning was that definitely the statics, the simple photo posts, they were working out really well for us. And what I would also say is that, when we created content, there was, let's say, rational content and there was emotional content, right? Something, when I was speaking about, picking up on situations from your life and, marrying it with the whole context of HIV, those pieces work better for us than, let's say, data and those kind of things, right? Because those were the pieces of content that people related most to, they identified themselves with. So yeah, for us, our learning was that, something which kind of picks an interest, or let's say picks an emotional chord with the audience, that worked better for us. It generated better leads for us.
Mm-hmm. Are there, okay, so we have a series of questions that are some very interesting ones that are in the Q&A. Are any of our panelists prepared or want to address any one of those?
I can briefly tackle this question about the lifespan of the collateral material.
Perfect.
So yeah, I mean, I think that I certainly don't have an answer like it's exactly 3 years or anything like that. But what I would say is two things. One is it's important to know that in most cases, we're not saturating markets, right? At least in our experience in the US, the budget size that we have is such that, you know, a few people will see these ads a few times, maybe if we do well. And that relative to, you know, companies like, you know, Coca-Cola, for example, where they have budgets and they're making sure that everyone is seeing their ads over and over. So I want to remind people that again, in our experience, I think, you know, reusing ads or using ads from even another part of the country, it's not like, oh, everyone's seen this and they're done and they can't use it again. And again, that's more from the standpoint of ads per se than maybe like a social influencer campaign. But also I would say for the most part, a lot of, you know, unless the actual information has changed, I don't, you know, most of these don't necessarily have a particularly short lifespan, or if the, you know, if the creative looks like it's from a decade ago, you know, perhaps you don't want to use that because it looks old, right? We want to keep things, you know, fresh, but generally I would say it's probably, you know, at least several years in my experience.
I also wanted to, maybe I think Yatin has some great experience on this, is when they have done advertising and some of their other organizations or competitors, and they have done advertising related to sexual health. It's incredible how timely the content can be. I remember one ad that went out a day after the lunar eclipse, and they did an ad with the image of a condom over a light, and that was like their lunar eclipse, and had a great caption for it. But of course, that's not going to last more than a week. There's certain content that really is super timely, and it also making sure that the content. So there's a benefit to having content that lasts a long time. That's your general brand that you make, that is designed into all your content that can use, you know, vectors or stock images. But then there's the very timely content, and those are things that can sort of go viral in a sense online and get you a large reach just because it's super funny, super topical. I don't know if Yatin or others have any particular experience with that kind of content.
Well, in our case, you know, we did leverage on a lot of topical and contextual content, right? When we started the campaign, you know, there was a Cricket World Cup that was going on, you know. So, you know, in India, it's like a religion, right? So we did a lot around cricket. Then, you know, there were, you know, some of the other social media topics that were popping up every other day. So we kind of picked those things up, married it with our context, and, you know, we saw great results. It works. But, you know, in terms of the lifespan, it just lasts for a couple of days, right? But if you look at the whole array of content that we had created, some pieces had a very short lifespan because, you know, they were married to something that was happening in the environment. But you know, if I were to give you a breakdown, I think 60 to 65% of our content pieces are something which can be used by other, you know, we can reuse them, repurpose them. You know, I also feel that, you know, in certain markets, they can be used as is. All right. So they have that kind of lifespan. You know, I would encourage, please go to the Facebook page for Yes For Me. Look at the kind of social content we did last year, and you know, please connect with the India team, and they'll be happy to provide you with all the assets that you may need.
Great, thank you. We're a little bit over time on this fishbowl and the discussion, but there are more questions in the chat. So I'll ask the participants of this fishbowl to go in and look at those questions. You can type your response there, and we will also collate all these questions, get more detailed responses from our panelists, and send out as a Word document or PDF document to send to everyone. So you will be able to have that information and responses to your questions. There's some great questions here. You know, is it ethical to go into a dating app and target someone to influence them to get a test? There's some other very interesting one. Here's the cost effectiveness of these approaches. What's the cost for the case finding of those that you are reaching through these marketing approaches? Really, really great questions. So thank you all for your questions. We're going to move on to the next fishbowl. Purvi will go to the next slide. And first, thank you all to our last panelists, Jen, Dan, Becky, Yatin, Oates. And so in the next fishbowl, we'll be focusing on a new topic of engaging social media influencers to support demand generation and uptake of HIV services. And we'll use the same format. Let me introduce each of our 4 fishies. Next slide. So Alice has served as a program officer in both the Linkages and EPIC projects since February 2016. She has supported 6 implementing partners in key population programming and has led the Going Online initiative in Kenya, which launched March 2019. And this platform has been instrumental in reaching men who have sex with men, other gay men, outside of the normal program, and identifying those who are HIV positive to help them get onto treatment. Next. We have Vinich, who serves as a technical advisor for SDCC, Social Behavior Change for HIV, and online services at the Linkages Project in Cambodia. She's worked as a creative director and communication strategist for Minor Act, a nonprofit organization house that makes transformative media projects with struggling young creatives from underrated and vulnerable communities. A recent project called Unexpected Songs was a multimedia music album that gathers these young creatives to revive the lost arts and cultures in Cambodia since the Khmer Rouge. As a head of communications at a digital marketing agency, Vinich also is involved heavily in content strategy and influencer marketing for commercial clients and creative campaigns. All right, next. We have Rory. Rory Asari worked with Indonesia's news channel for 9 years before dedicating to venture on business and social media activism. Through his YouTube channel and Instagram account, he talks about issues that many Indonesians avoid talking about, such as what if your kids are gay or lesbian? Or are you not getting married? Toxic masculinity and hopes versus facts on HIV. Rory aspires to mainstream topics that have become the core of the problem of prejudice and stigma by creating conversations. And last, next slide, is Sam. Samantha is the managing director and co-founder of Percolate Galactic, a Jakarta-based full-service creative studio and production house. While the studio's public-facing persona is decidedly offbeat, a pillar of the business is called Galactic Good, an initiative dedicated to corporate social responsibility, as well as to serving NGOs and development organizations from around the world. Galactic Good harnesses the expertise of each of the studio's in-house teams and adapts it for non-commercial use. Sam and Percolate Galactic were involved in Linkages brand development and a creative campaign for updatestatus.id, which was their online HIV service campaign and service delivery approach. All right, we'll go to the next slide. So again, we have 20 minutes for the fishbowl, and Alice will kickstart the discussion. No need to give a program review, just jump into the questions you have for people on the panel, and we'll try to make sure everyone is able to share their experience and ask their own questions. So after the fishbowl, we'll also have 10 minutes for discussion. Fishies, are you ready? Turn your mics and cameras on, and Alice, you can take it away.
Thank you, Ben. You know, one of the things that we learned within the Kenya program is the importance of getting the right influencer. You know, the influencer who has the right following, the influencer who will be able to appeal to your target population. And for us in Kenya, we were looking at those who are between 18 to 30 years old who are at risk of acquiring HIV. And so that was really key for us, that, you know, who do we go for? And it took us a while to just get the right influencers. What worked for us was the fact that once we started to work with the creative agency, then it became easier for us because then the creative agency was already in touch with some of the influencers. But of course, we had to agree on parameters. What kind of influencer are we looking for? And I remember when we started off, we had a whole list of about 10 influencers. But then the cost was quite high, and then we had to go back down and see who can we work with that will still be able to capture our audience. So I'd just like to hear from my colleagues, Cambodia, how did you go about identifying your influencers, and what were you looking out for? What were the costs like, and how did you guide them in terms of just making sure that they are reaching out to the audience, yet still giving them that freedom to make sure that they pass across the message and are able to influence people positively, and encourage them to go encourage them to book for an appointment and eventually go for an HIV test. So I would like to hear from Cambodia, from Vinik.
Yes, hello, thank you, Alice. So in Cambodia, I think at the moment, we haven't really utilized a lot of influencers. We have few that we've been working with. So first question of how to actually get the influencers, we're trying to look at somebody actually reach out to anyone who's interested, and kind of like, rather than just look at the numbers of the followers, we're trying to get somebody who kind of also advocates for social development and have the interest in the topic as well. So recently we worked with one of the influencers, and he's could be one of our KPs, and he understands the KP have the followers who basically a lot of like MSMs and so on. So we'll kind of look at that. We approach to him, and then we'll kind of have the honest conversation, and then see what he understands the goal and the missions of the things in general, and how to actually deliver the message is that we work with influencers, but then we also helping him out in terms of content strategy, content planning, and then we share about key messages that align with what we've been talking about. So for example, we've been really focused on PrEP promotions and also the condom use. So our influencer has been very helpful when you mostly kind of also help us out voluntarily as well. So this is what we need from someone like this, is rather than just see it as commercial advertisement, but they actually very passionate in helping with all of that. I think that was the two questions that I have answers from you. Is there something else I'm missing here, Alice?
No. You've captured them well. And also just here, I would also just like to hear from Roy. Roy, being a reporter and working in a context that sometimes sexual and HIV issues, sometimes it gets sensitive when you are in an environment that is not so quite open. So Roy, what has been your experience with, having to deal with such matters within your context of reporting?
Regarding my experience on, doing activism about HIV issues, is that Indonesia as a country is way more conservative than it was 10 or 15 years ago. Like 10 or 15 years ago, major publications like a newspaper called Kompas, they put a story about gay couple living together for tens of years on their headline, and people were okay with that. People were chill about it. My mom was even laugh and found it unique. But today, such a treatment or such an action would put a threat or a life-threatening danger to the couple covered in the newspaper. This conservatism has grown exponentially since the 27 Jakarta, the capital gubernatorial election. So the country is now, it's like divided between conservatism and more liberal approach. So it's getting more challenging nowadays to talk about HIV campaign openly. And I got many backlash from my followers who are not, only modern, those who have modern way of thinking, but also those who are conservative, especially living in rural areas of Indonesia. And the saddest part is some of my followers, they attack me because the message that I spread, the message that I conveyed, but actually I knew them, that they were once part of the gay lesbian community, but attacked the HIV activism as a, are you supporting gay lesbian group in Indonesia? Because gay and lesbian group in Indonesia is very sensitive, and a politician or a public figure known to support this group, it's going to be a doom for them. There was one political party called PSI who openly supported gay and lesbian, and after that they got many social media backlashes, and I believe their popularism among Indonesians youth, because that's their market, shrunk at that time because of their openness in supporting gay and lesbian activism. So it is a very conservative and debatable topic in Indonesia nowadays. So yeah, I've got many backlash from that.
Rory, as a follow-up question, how do you avoid the backlash so that you can continue reaching the right audience in your context? Or how do you respond if there is a backlash?
Yeah, I think backlash is unavoidable in this context, Ben. Like Finish earlier said, that you need to find influencer who has sense of activism, who mean it when they say it, right? So I think it's a consequence of, choose this path as an activist or social media activist. And I don't really give a damn about it. If I want to move forward, then I move forward. There's no such risk as, saying what I need to say. Even my ex-office, Metro TV, didn't mind about it. They mind when I talked about what if your kids are gay and lesbian, but they didn't mind when I talked about HIV awareness, because it was a health campaign and everybody needs to know. I think that's what they thought back then. But when I talked about what if your kids are gay or lesbians, and I discussed it with different point of views, they objected to it and they lightly reprimanded me.
I think I can also add on to this. So I work closely with Rory. My team worked closely with Rory and the other influencers in Indonesia. And one of the things that is probably a little bit different about what we do in Indonesia versus what is in some other countries is we sort of avoid talking directly about homosexuality or sex workers or anything like that that might get the brand in trouble, that might get the campaign in trouble, and definitely we don't want to get our influencers in trouble. So we try to make sure that what we're asking our influencers to do, and also what we're doing ourselves when we're making ads, when we're making social media posts, things like that, is to keep it very much about health and wellness and getting tested because it's a responsible thing to do and that everybody should do it. So we're very aware when we're asking any of the influencers that work with us to do something that we're not putting them in a position that might get them in trouble, because in Indonesia it can be very serious trouble. It's not just like, oh, you got canceled on the internet. It's like, now you're in jail. So yeah, we're very aware of the risks involved and the risk that our influencers are taking by partnering with us on this campaign. And so we really, really respect them and are so grateful for them for willing to do this. And then also we just sort of repay them both monetarily, but also with being very considerate about what it is that we ask them to do.
Sam, if I ask you a question that
yeah.
I think it's not only in the US or other parts of the world that hoax is on the rise. In Indonesia, it's not an exception that hoax is on the rise, and the elderly and lots of parents believe those hoaxes regarding homosexuality, regarding HIV test, regarding HIV through WhatsApp, or through Facebook, or even other social media accounts. How does your organization target parents? Because at the end of the day, they also play a very significant role to Indonesian youth.
So, so we do what FHI 360 Indonesia tells us to do. So maybe that's a question for somebody from FHI 360. Yeah.
That's a really good question. No, I mean, like Sam, you can address how we target youth, because our target audience is youth, and we don't always have the money to change the perceptions of the entire country. Sometimes what we do, or what we've suggested, is, an example might be hand washing for COVID, right? The people who are vulnerable for COVID might be older, right? But we're reaching people online, so we target like the nieces, nephews, granddaughters, grandchildren, sons and daughters of the people who we're trying to reach. We reach them online first, and we can do it like a campaign among them to engage their older family members. Those are things we've suggested among other kinds of programs where we really do target elderly in terms of either their behaviors or their perceptions. But in Indonesia, I'm not sure we were focused enough on the elderly. Like, for instance, all of our influencers have
young
followers that are young, under
yeah.
35, under 30 probably.
Well, what we do is also, when we're creating content, whether it's general content or it's influencer content, I feel like it's really shareable and digestible by anyone. So we're creating it with this person in mind, with this persona in mind that we want to target, but the content doesn't exclude anyone. So while the first person who reaches the content, whether it's a post from Rory or whether it's just something general shared on social media, might be for that person who's like 32 and gay, it's something that they could potentially share with their auntie. So it's not something that would exclude it from being shared with older generations. But that's not our first point of contact.
I have a question for the team. Just knowing that influencers have a different voice, how have you worked with influencers to ensure that they maintain their voice with their followers, but also say the correct thing when it comes to HIV and promote it the correct way without having a negative backlash?
I had network challenges. But one of the things that we agreed on is that we will be reviewing the content, much as the influencers are free to tweak the message to suit their audience, because they understand their audience better. But all they said, you still want to make sure that, they're giving out the right HIV information. And so we gave that leeway for them to just be creative enough with the kind of message. But then what we look at is, would they kindly share with us before they share it out? So we then review and just make sure that they pass across the right message, but then they do it in a way that is appealing to their audience. And one of the interesting things is that, one of our influencers was a community member. And this community member, much as the messages were open, it's about HIV, it's about transmitting HIV, the community members would literally listen to him. And so he was able to mobilize more MSM, and partly because he was really a community member. So just making sure that the messages are reviewed before they are posted, but also giving them the freedom to do it in a way that will be appealing to their audience. So maybe my other colleagues can also share.
Go ahead. I'll go after.
All right. Just to carry on from Alice, is that from what we're doing with our influencers, is that we want him to be, he was playing like a neutral kind of like persona, in which he just like most of the time just encourage people to go to do testing or whatever. So that's from his kind of like personal contents, but something specific, like Alice just mentioned, usually we're trying to like, it wouldn't be like training, but kind of like brief him with a certain kind of like keywords. For example, when we're talking about HIV self-testing, so what it means by reactive or non-reactive, this kind of key term is very important. So then sometimes what we are trying to do with the normal advertisement, it doesn't really register with the audience because it sounds very complicated. And usually they won't be interested to hear that from the doctors or anything. testing. So in a good way, we use influencers to kind of like, he can talk about his experience of using HIV self-testing, and then he would go through all this process explaining of like, try to make sure that it's basically just a basic kind of testing, but certain like reactive doesn't mean that you're actually positive, that you have to actually go for further kind of testing. And then this is kind of the ways that we're trying to work with influencers. But going back to the issue, actually, I just want to share what has been a challenge in Cambodia is that every time we approach influencers, they have the fears of like, they aren't sure to associate with the HIV campaign. So like they understand that key population most likely are MSMs or transgender, all of like LGBT community. So in a way, they were just don't really want to feel like have any misunderstanding if they are straight or they are not belonging to KP. So this kind of like still the misconception that they are having at the moment. And influencers kind of things in Cambodia is still like a gray area. You know, there's a different way, a different type of influencer, and a lots of time is mistaken of like who exactly as influencers, and then just like their follower too. So sometimes young people are just having millions of followers on YouTube, but they kind of like, it just happened because they do some sort of like a different thing, which wouldn't really consider as influencers. So probably this is something I would wanted to hear from you all. Probably you can share experience of like, how would you really identify influencers of like, and was there any similar kind of challenge happen over there as well?
That's a really good point, and something that like we feel as a creative agency and a supporting partner really passionately about is making sure that we get the right influencers. And a huge thing is like the number of followers really doesn't matter. It's more about who those followers are and what the level of engagement is. So I would much rather spend our budget on somebody who maybe has 11,000 very dedicated, engaged followers than somebody with 1 million followers that are just running the wide spectrum. They don't have a great conversion rate or engagement rate. So it's very, very important to us that when we select somebody to work with us, not only are they going to be a good representative of the brand, but that there's going to be a good ROI. We don't want to be wasting money. I mean, to put it really bluntly, we could take that money and spend it on targeted Facebook ads and potentially see a better ROI if you don't partner with the right influencer. So it's very, very easy to waste money when you're working with influencers or KOLs if you're not super strategic about it. Ben worked with us really closely when we launched Update Status in Indonesia, and I think that it was Ben's idea to have a competition at the launch party. And that was one of the ways that we actually figured out who had the best engagement rates, was that we gamified the launch party by inviting a whole bunch of influencers, and then we gave each of them a unique URL, and we asked them to just like post about the launch party. And then we were able to see how many conversions these people actually got, and that's how we decided who to hire. So they didn't know they were auditioning, but but they were auditioning. And so credit to Ben on that great idea. Yeah, so that's one of the ways that we figured out who were the right people to engage.
Thanks, Sam, and thank you all for this great candid discussion on influencer marketing. We don't have any additional questions in the Q&A for you all, and we're nearing the end of this session anyway. So please, if you're listening in, you have questions about influencer marketing, and you want us to address them, you can enter them now in the Q&A, and we will address them in a document that we'll send out after the webinar. So be sure to send those in, and we will have those addressed. I just wanted to say that yes, these marketing approaches cover such a range of marketing objectives. While the ads can reach many people all at one time, and yes, you can target pretty narrowly based on interests or the platforms that people use, and you can engage them depending also on the content or the creative content you're using. Influencers have a different sort of approach. They have their own generated audience they have built over maybe years. They have a specific value to the people who are following them. And the benefit of engaging influencers are that you can bring personality to the services that they might also see in an ad. where the ad gives some legitimacy to the product that you're selling or the service that you're offering. Influencers can make it relatable. And you can also engage influencers on promotions that are not as seen as much of an advertisement. You know, for instance, an influencer can simply go for an HIV test and post about it, or use your service booking platform and post about it and say, oh, look what I did. Look at the result that I have on this risk assessment I did, and not need to say that, you know, not need to do a video saying that they are doing a promotion. However, if they are paid, in many countries there's a requirement that the influencers say that it's a paid promotion. But where possible, influencers who are already interested in supporting their followers to learn about social causes, health, or otherwise, they can be engaged and may not need to be paid. And as Alice said, the HIV program can be on standby. We set up WhatsApp groups for the influencers to participate with technical advisors from the HIV program to always, on demand, live support those influencers to address questions that come in from their followers, to help their followers book services. If there's any backlash that occurs, to provide the correct kinds of responses that are going to neutralize the situation. And this happened in Indonesia when an influencer we engaged had posted about a reported case of transmission at a spa from a facial procedure. And she got on all the news networks, and we were on WhatsApp with her constantly, providing her the right kind of information, data, and ways to frame the situation. And as a result, she gained something like 40,000 followers, and she was able to very clearly, explain how HIV can be transmitted and how to get an HIV test if people are concerned. So I just wanted to share some of those results and methods for influencer marketing. Please also enter your questions in the chat. And thank you, Alice, Vintage, Rory, and Sam, for your participation in the fishbowl. I'll go ahead and continue by just listing some resources that we've been given or that we have ourselves to share with participants as they plan and consider these approaches. So Purvi will go to the next slide. And we'll go to the one after that. So we're going to be on slide 32, where it says going online. So at Linkages and FHI 360, we have compiled this framework for going online and described the various approaches and how you can consider them in sort of a mixed approach for online marketing, using people to go online and promote demand generation, advertising platforms, and influencers. And you have here the link to this document called the Going Online Vision. We'll go to the next slide. And if you like this same Going Online Vision in a more digestible format that's easier to understand in terms of how we at FHI 360 actually implement it, we have this 36-minute video, and it includes examples from Indonesia and Kenya on how we implemented advertising and influencer-based approaches. And you have the link here. We'll go to the next slide. We also put together a technical brief for HIV programs on how they can implement social influencer outreach. And this will give you tips on how to do payments, how to find your influencers, how to engage them, how to moderate any risks that might come up from using these approaches. We'll go to the next slide. Also integrally important is how you link people that you reach online to offline HIV services. And we recently launched a website called QuickRes, which is an online reservation and case management app that can easily streamline the connection of your online marketing approaches to clients' uptake of HIV services. And we have a link to the technical guide on that technology there. And also in the chat, every single resource that I'm mentioning, I have shared a link. So be sure to copy all of this from the chat and put it on a file that you can access after the webinar is over, so you can access these resources. Additionally, we'll send these in the notes that will go out after the webinar. Next slide. At FHI 360, we host a public WhatsApp group chat. And in this group chat, we have staff of online HIV programs that are leading their own programs, online HIV marketing approaches. And there's continuous discussions around approaches being used, the effectiveness. So everything that we're discussing today is ongoing on this group chat, and anyone can join it, but it really is tailored for HIV programs, or for instance, managers of programs, or even online outreach workers themselves that are needing support on how to do their work better. And you can click that link to join the chat if you click it on your phone where you have WhatsApp. Next slide. So Grindr has been a partner with FHI 360 to promote HIV services through their Grindr for Equality program. And they allow us to schedule free broadcast messages. You can see here. The link you have here is to a resource guide on how to leverage this same program for the same offering for your HIV program. We'll go to the next slide. And I think we might need to click once to show. Great. So Google also offers free advertising options for nonprofits. They offer up to $10,000 monthly in-kind advertising. When people search for related services, they can find your service. And this is an example from our work in Kenya. So in Kenya, we've set up the online ads, and they've been implemented for over 18 months. And we have used $2,000 over that period. Even though the maximum is $10,000 per month, it always depends on the number of people actually searching for your topic. And if they search for it, then it gets added to that total. So we've still benefited from around $2,700 in advertising that is for free. And the link here is to a page where you can see if your country and your organization could be applicable for the scheme from Google for nonprofits. Next slide. Our partners who are on this call, Building Healthy Online Communities, have a lot of really great resources that break down how to do online advertising. And they're focused mostly on US-based organizations serving gay men, other male-sex men, LGBT populations. But I think they're very much broadly useful. So you see here a link to a list of advertising tips, and you see the topics here on this page. Go to the next slide. They also have a repository or a clearinghouse of different ad campaigns that have been used for topics such as PrEP, U equals U, which is undetectable equals untransmittable, HIV testing, and other health services. And while they are while the campaigns listed are more or less US focused, there are examples of others, and they're open to adding additional campaigns to their clearinghouse. And you can access these examples on the link here. Next slide. Also, BHOC, Building Healthy Online Communities, launched one of the first anonymous methods to notify your partners to get tested for STIs, like anonymous partner notification called Tell Your Partner, tellyourpartner.org. And we at Linkages and FHI 360 actually really learned from the way that they presented this to clients to add this to our own online reservation application. So it's a great thing to look at, and it helps decentralize how you would advertise services to clients, basically through people who might have been affected referring their partners. Next slide. And BHOC collaborated with NASTAD, a US-based group, and a marketing agency to have a series of webinars on actually how to buy online ads. So this is very practical step-by-step guidance on how to buy online ads on various platforms like Google, Facebook, Grindr, Instagram. The link here will go to this webinar series, and you can go through the slides or listen to the webinar series and follow those steps for yourself. Next slide. I listed this here. This is actually showing how Percolate Galactic, as a creative agency, helped our program develop our brand and put out ads and influencer promotions it's a great way that they documented the kind of work that they've done with us, and you can see this at their website, which is the link here. Next slide. One thing that we always do try to reference is how many people use digital technologies, mobile phone use, social media, e-commerce. And we find a lot of this in the annual reports from We Are Social, and you can find that at the link here, including country-specific reports for every country in the world. And they also released a mid-year report this July showing the impact of COVID on these trends as well. So that might be useful for you. Next slide. All right, so those are our resources. I want to thank our Going Online team you see here, which supports countries to implement these approaches across our portfolio. And we'll go to the next slide. And I want to thank everyone who joined this webinar, including our panelists and those from Percolate, Leo Burnett, Building Healthy Online Communities, and our own staff from FHI 360. Thank you so much for your time. We're exactly on time, and we'll be sure to send all responses to your questions as an email to those who registered for this webinar. Well, thank you for your time and enjoy the rest of your day. Any additional questions, do let us know.